This is part 5 of the series of chest pain I said I'll be talking about. I've talked about a lot of causes of chest pain, part 1 to part 5. So please watch those videos. Today is part 6 and we'll be talking about pneumonia. For those meeting me for the first time, I am an emergency medicine physician. I see patients with acute and life-threatening illnesses every day. Now, what is pneumonia? Pneumonia is another name you can commonly use to call chest infection. And what is this chest infection? In a simple term, I will best describe it as an inflammation or infection of the air sac within the lungs. Okay?
Bring some unwanted guests like microorganisms into the alveoli, where these guests start to thrive and multiply, causing a lung infection we call pneumonia.
Now, if you have certain type of symptoms, you might be dealing with pneumonia. I'll just name them for you, and I'll name just these 4 of them. 1, if you're having chest pain and you discover that with that chest pain you are having fever, your body is hot, you're also having shortness of breath. Fourthly, you are also feeling generally unwell. The 5th thing that will be part of it will be cough. If you have these 5 symptoms, you are dealing with pneumonia until proven otherwise. And your question will be, what is causing this pneumonia? Pneumonia can be caused by various pathogens. It could be viral, it could be fungal, it can be bacterial. But today, we are narrowing this pneumonia to bacteria because that constitutes the vast majority of cases. Now, pneumonia broadly, we can divide it into community-acquired pneumonia and hospital-acquired. Hospital-acquired simply means pneumonia that you got while being in the hospital. While for community is outside the hospital, basically. But that's not where I take interest in today. What I take interest in is the symptoms that you have and what do you have to do next. So if you have these 5 symptoms I've talked about, it's not compulsory that 5 of them will always be there. You can have 3 out of that 5. You can have 5 of the 5, as the case may be. Now, what do you do? That's the most important thing. You need to see a doctor, and the doctor will do a proper examination where he will pick some signs. He will listen to your chest. He will hear some abnormal sounds, which we call bronchial brain sounds. Okay? But I will not talk about those details. The thing that the doctor needs to do to make a diagnosis, you have to do just 3 investigations. 2 of them are blood investigation. 1 is radiological investigation. So, the first blood test, the doctor will do what we call a full blood count and inflammatory markers. So, the full blood count, which is white cells and its differentials, with inflammatory markers such as CRP, will give a picture that you might be dealing with a bacterial pneumonia. The second blood test that the doctor needs to do is what we call a blood culture. Now, this blood culture is for those that will be resistant to treatment or those that will just want to get the sensitivity to know the particular antibiotics that will be needed. Okay? The third thing the doctor needs to do is a chest x-ray. Now, once the doctor have done all of this, a diagnosis of pneumonia is made. The question next is, how do you treat this pneumonia? The treatment depends on a scoring system. There are some patients that we can treat at home, while there are some that needs to be admitted. So we use a scoring system we call COP 65. So with that scoring system, we know if this patient needs to be admitted or not. All right. Now, after that decision is made, the severity of the pneumonia is also classified. So these are the things that will now determine your line of treatment. Now, the doctor will either use amoxicillin, amoxiclav, clarithromycin, oral medication, or IV medication, as the case may be. Okay, now in some patients that the temperature is so high, the doctor will not only give antibiotics, the doctor might also give what we call antipyretic medications just to bring down the fever. Okay, so this is just a summary of what pneumonia is. If you have questions about this, please put in the comment section so that I will explain further, because there are several areas of pneumonia that I didn't cover in this video. I know you have learned something today. Please like, share, and comment, and I will see you in the next video.